My name is Chislon Chow, and I'm here to give a presentation on ADHD. I'm a registered psychotherapist in Ontario, Canada, and I'm also giving this presentation from the perspective of somebody who has been diagnosed with ADHD. So, as for this presentation, the language I'll use ADHD is referring to attention deficit hyperactivity disorder, ADHD for short. And when I refer to persons who have the diagnosis or who may have ADHD, I may refer to them using identity first language, such as ADHDer, or person first language, such as person who has ADHD. I'm aware that there is a debate of which term may be better. I actually believe either term could be appropriate depending on the individual. I do not think that ADHD should be stigmatized, so I believe that identity first language is potentially appropriate. And I also will try not to use terms such as special needs, special education needs, because those are terms that are, although used in education systems and in certain countries, may not be so useful and maybe be seen as patronizing by advocates. Some of the alternatives include terms like functional needs, tailored assistance, and neurodivergent. But when you use the word special, sometimes that is a cause for concern. So when we talk about prevalence of ADHD, the worldwide prevalence in children is 7.2%, or pretty close to 10%, 1 in 10. And when we're talking about adults, we're talking about 2.5%. It seems to be more frequently diagnosed in males than females, at a ratio of approximately 2 to 1 in children and 1.6 to 1 in adults, where females are more likely to show with inattentive traits as opposed to hyperactive traits. There could be various reasons for this, but maybe females are more socialized to not be hyperactive, but then even though they have ADHD-like traits, they may not exhibit them in the same way. And we're only talking about diagnostic traits, so this may be under or over. And I'm personally under the impression that this may be underdiagnosed in the general population because of the lack of access and also just other types of challenges that may prevent diagnosis. As for this list, it's a list of ADHD public figures. Some of them are just ones that have identified with ADHD in the global stage, and others are ethnic Chinese ADHD public figures. The point of this list is just to show that they have ADHD, but are also successful in a variety of careers, anything from media to healthcare or business and also athletics. So it doesn't preclude or exclude people from being successful in their career paths. I'm going to go into some of the examples. So Sammy Leung is a Hong Kong-based radio host and a well-known ADHD advocate. So he identified that when he was in school, he had a lot of challenges in learning certain subjects and also paying attention when he was in class. But then this would also be a problem for him while he was in school, and he didn't actually have a problem later on in life, as you see that he has become quite successful, but then there are certain career paths that he wasn't able to take as a result. And at the end of the day, it worked out for him, but then there are particular challenges that are common with ADHD. This is a well-known singer in a band called Mir. His name is Ian, and he's just saying that his ADHD, when it presented itself, resulted in challenges with his family when he was young, and he was also quite emotional. This is a Chinese Canadian actor, better well known as being a Marvel movie actor, and also Kim's Convenience actor Simu Liu, and he was diagnosed later on as an adult, where he identifies as somebody who is forgetful and lacks motivation in some areas, but then also hyper motivated or hyper focused in other areas. So this is another common trait for ADHD, is that there are certain things that they're expected to do or that they want to do, but they can't do it. But then they seem to be able to put their focus on certain things as well. This is another example, Lisa Ling. So Lisa Ling is a well-known journalist who was diagnosed in her adulthood, and she's saying that the diagnosis actually helped her because it gave her relief, but at the same time, it was also a frustrating experience, especially in her ability to focus on what she needs to do. And being a journalist, she's quite successful in what she does, but then she's also had challenges. I want to highlight also this example from psychiatrist Shiva Reiko. She had a book out in 1997, which is quite a long time ago. But the point is, she used this example of this really popular anime, especially for Hong Kong, but it's a Japanese anime, Hong Kong slash kind of Southeast Asia area, where there's two main children characters who one of them shows more of an attentive trait in terms of the procrastination and also the seeming laziness and inability to have motivation. And it's the one with the glasses. So that's Nobita. And then the other character, Gion, is the one who is pretty much bullying Nobita in this picture here. And really, it's just saying that this anime shows two of these characters with differing ADHD traits, Nobita being the one who is inattentive, and Gian being the one who is hyperactive. So the impulsivity side of things shows up more in Gian, and also just sometimes being reckless with the way he acts, and in this case, physically. This is a very popular anime. It's also well-loved anime. And what this means is ADHD may be all around us and we may not know it. We may not recognize it as such, and it may not necessarily be even something that we keep in mind until we kind of pay attention to it. Now, ADHD, why I want to talk about ADHD is, for one, it's a health problem. What I mean by that is it actually reduces life expectancy if it's not dealt with, or potentially it is correlated with particular types of health outcomes. And these are some of the reasons, right? So with ADHD, it's correlated with things like higher risk for accidents, self-inflicted injuries, for example, like car crashes. It's also resulted in higher risk for things like suicidal ideation, suicides, obesity, eating disorders, sexual and reproductive health problems, drug use, sleeping problems, and also other comorbid psychopathologies, meaning that they can be diagnosed with other mental health issues. So when somebody has ADHD, they may not only have the ADHD itself, but then it may result in certain other challenges in their life, which reduces their life expectancy. And to add to that point, compared to certain other types of health conditions, such as smoking, obesity, alcohol use, high cholesterol, high blood pressure, ADHD actually reduces life expectancy even more than some of these any single factors. So ADHD is actually a significant health concern that should be treated and could be treated. Another challenge with having ADHD is that it can result in couple relationship problems. So in a marriage or just in a partner couple relationship, when one or both of the couples has ADHD, it can result in particular challenges. And these types of challenges can impact the stability and the satisfaction in a couple's relationship. These don't necessarily show up early on in the relationship so much as when they are expected to cooperate on certain tasks and do certain things together, that they have these challenges, and it can really be a cause for concern. The author, Melissa Orlev, has personal experience of being in an ADHD marriage, and it's not so much that we have a lot of data on how exactly this looks like, but this appears to be a quite significant problem. And even in my clinical experience, a lot of couples who have one of the partners being identified with ADHD or even just having ADHD symptoms will have a lot of challenges in their marriage as a result of the ADHD that symptoms that may not be treated. So what exactly are we talking about when we're talking about ADHD? We're talking about usually a mental health diagnosed disorder. So what that means is, typically speaking, this is a diagnosis that's given by a medical professional who's qualified to give the diagnosis. I'm not a doctor. I'm a psychotherapist. I do not give diagnoses, but I can also just I cannot give diagnoses, but I can educate based on what I know about these conditions, based on my expertise and based on my education. So the diagnosis usually refers to a condition that is listed and published in a published manual. It's by the American psychiatrists and other professionals that are known in the field, called the Diagnostic and Statistical Manual of Mental Disorders, and it's currently on its 5th edition, text revision published in 2022. And it really just talks about what ADHD is and what to expect when a diagnosis can be made. I'm not going to go into the details in the DSM about what ADHD is inside, other than just to give a really, really broad stroke and overview of what it is. So you can end up effectively with 3 main types of presentations. So you can end up with predominantly an attentive presentation. You can end up with predominantly hyperactive / impulsive presentation. And then the combined type is a combined type of both of them. So effectively, what that means is, I'm just going to read out the description, is the essential feature of attention deficit hyperactivity disorder is a persistent pattern of inattention and / or hyperactivity impulsivity that interferes with functioning or development. Now, what this means is you can't just only be inattentive and or hyperactive. It actually has to interfere with some sort of functioning or development. As in, for a child, it's actually some sort of developmental, perhaps delay or challenge in some way. Now, this DSM criteria, it's not going to list all the aspects about what ADHD is, but then it's based on research as what is known about the condition and what they'll put in the manual. But then there could be actually more types of traits or more types of behaviors that can be associated with what ADHD actually is. It's not necessarily comprehensive, is what I'm trying to say. And that's a very important part of just when you get any sort of mental health diagnosis, not only just to use a more technical or the scientific terms, but to actually really understand the experience of what ADHD is like. Okay. So another thing to pay attention to is that ADHD symptoms have to occur before childhood. It is a neurodevelopmental disorder, meaning that people have to be born with what that is, and it's something that they have had since childhood. It's not just something that's happened to them all of a sudden. And it's something that doesn't go away, it's persisting, and it also impairs them throughout that process. So it's something that has been a challenge for them. And I would say that also, if someone's being concerned as an adult, but then they're saying that they're not having as much symptoms as they were young, it doesn't mean they never had ADHD, or even that they don't have ADHD, because it's common that ADHD, the way it presents itself, changes through the lifespan. In particular, they may not be as hyperactive as before, but then they may still retain or have significant challenges with their attention. So, for example, the procrastination, the difficulty getting organized or getting things done, the self-motivation, those things can continue to be challenges or be challenges for them in some way. It's a chronic neurodevelopmental condition. It's possible, actually, that some children who have the ADHD may no longer qualify for an ADHD diagnosis when they're older, but then it doesn't mean all their symptoms will go away. It's seen as genetically inherited to a significant degree, but it does not necessarily mean that is 100%. It's possible that you don't inherit ADHD. It's not 100%, but they also don't know if there's any specific gene, and they don't know if there's any specific cause, although there's also other speculations and or studies that have tried to identify there are certain things that could be correlated with ADHD, which I'll not go into here. There's another point to be made about something called epigenetics. So even if you have a genetic trait that could be passed on, it may not express itself and may not become whatever that gene represents. So just because there is for at least for ADHD, just because there may be some sort of heritable trait or heritable lineage of ADHD does not mean the children necessarily have it. Or it may mean that if the child has it, does not necessarily mean that the parents have it. So it's not 100%. That's just something to pay attention to. And the 74% is a figure that's correlated to twin adoption studies. So it's not saying that it's going to be 74% every single time as a number that you need to pay attention to. But it does signify that there is a high probability that it could be genetic and that it is largely understood to be genetic in cause. Now, as for diagnoses of how people get diagnosed, as young as age 4 is typically what I've seen out there in terms of the literature. But typically, why and when kids get diagnosed is not so much when they're with their parents or with their family members, but it's actually when they get in school and they have to follow rules and they have to get along with people. That's when they get into trouble. There's no diagnosis based on any sort of blood tests or based on any neuroimaging. So there's no point of getting additional tests for that specifically to get an ADHD diagnosis. They could diagnose based on behavioral traits alone. That's just how the diagnosis works. But then, um, just to be aware of what's out there, the typical way, at least to get a diagnosis in Ontario, is to go to your family doctor and talk to them, and they'll either give you a referral or some of them even give you a diagnosis. Some may choose to go for a private route of diagnosis, which is also possible. It's not necessarily even have to be a doctor. They could, there's other professionals, medical professionals who are qualified to give such a diagnosis. They may even give more thorough tests or different types of tests, and not only specific to the ADHD, because ADHD may be correlated to things like learning challenges or specific types of profiles that give different types of it's more useful to have tests for those as well. But then they may cost money because they may not be covered by at least Ontario OHIP. As for monitoring symptoms or even doing a self-assessment, children usually go through something called a SNAP-4. It has 26 items on it. That's not something that's necessarily done by the teenager. It's something that is from the parents and also from the teacher. They can fill it out and then you can pass it on to a professional to kind of evaluate how significant that is. And then the other one that is really popular out there, but this one's for adults, is the ASRS 1.1. So these are screens that people can do to get an idea of not only their ADHD symptoms, like these are screens that you can check to see how well you're doing with regards to your ADHD, but also just in general to see if that might be a concern. So ADHD traits, we're talking about the hyperactivity, impulsivity, and we're talking about the inattention. So these are just some categories of what that might look like. So the impulsivity, hyperactivity can occur in motor. So that means like physically, things like fidgeting, sitting, and jumping around, those type of things. Verbal is like blurting out things, saying things that are inappropriate or out of line. Cognition is how they think, how ordered their thinking is, whether or not it's making kind of logical sense, sequentially, etc. Emotional, again, it's like the magnitude or intensity of the emotions. And when it comes to inattention, a lot of it just comes down to like how well they can control their thinking. So these are different types of processes internally that help a person kind of put their minds together to come to solve problems, come to plan, and regulate their emotions. So these are the types of things that may be affected. Next, I want to talk about some of the myths that are common with ADHD. So a lot of people may have heard others say, or it might be really popular on YouTube, how ADHD is not a real condition. From the scientific perspective, it is a real condition. They've actually done quite a bit of um, studies on what that is. And when someone's diagnosed, it's just to recognize that they're what they were born with or what they were as a child is not at the same level as others in terms of their capacity to do certain things. So it's a neurodevelopmental condition, and it's primarily biological and genetic in origin, meaning that they, like, as a child and maybe even as an adult, like you can't really change your baseline. It's not saying that you can't improve, and it's not just to make excuses, but it's to recognize that this is where they're at, and this is what they're capable of, and they can make improvements, not compared to other people to do as well as others necessarily, but they can do as well as they can based on their limitations. And that's very important to recognize. The other thing to highlight perhaps is the question of whether or not ADHD individuals will just grow out of it. And again, because we're talking about a baseline, even though, sure, like they will lose some of the significant symptoms that bothered them during childhood because of their baseline, they may still experience certain impairments in particular areas that are typical of ADHD. They may no longer even qualify for the diagnosis, but then it's possible that they may still have significant challenges. So it's important to not just say that all ADHD individuals will grow out of it. In fact, a lot of ADHD children will benefit from effective treatment. And I can talk about effective treatment later on in the slides, but the idea that ADHD is just going to be something that kids will grow out of is not something um, that is true. It's something that, in fact, may inherently block a child from getting effective treatment, which will actually help them grow out of the situation that they're stuck in or the ADHD itself. So last one is everyone is just inattentive and everybody just has ADHD. ADHD has to be a condition that is significantly impairing. So just because somebody is inattentive, sometimes it doesn't mean they have ADHD as a diagnosis. It's very different. It has to cause significant impairment for them in some way. So that's not the same thing in terms of the whole spectrum. Somebody, if they're having problems and challenges to a certain threshold, then they meet the criteria for ADHD because they have met that threshold of impairment. So it's not just something that anybody could say they have. And the other thing is it has to be something that they have had since their childhood. It's not because an event happened to them and all of a sudden they start showing ADHD-like traits. That wouldn't be diagnosed as ADHD, although it's something that's significant and something that may look a lot like ADHD, but then we wouldn't just call it ADHD. That's all. Now, as for the impact of ADHD, so Dr. Russell Barkley is one of the most top experts in ADHD research and also clinical work. So, from what I understand, he tends to like to talk about ADHD in terms of executive functioning. It's kind of a more complicated term, but the point is the abilities that people with ADHD have to exert their self control. Those are areas where those with ADHD may have limits in terms of who they're in terms of how they are, in terms of how capable they are. Again, I'm not saying that they can't improve, but I'm just saying that relative to the general population, these are challenges that they tend to have, especially before any treatment that they have or before any type of um, basic intervention that they have. Like these are challenges that they will have. So things like planning and self-monitoring, which is kind of like where their mental GPS is, their motivation, which is like having a gas pedal and actually being able to do what they're supposed to or what other people expect them to do. and actually paying attention to do that. So that might be the challenge. Breaking, so self-restraint and inhibition, so both being impulsive to do something or not to do certain things, those are things related to the so-called braking mechanism. And the steering is actually it's being driven to do kind of the right thing, so-called right thing at the right time. There's an interesting flashlight metaphor that represents kind of how attention works. So because of ADHD, a person may not pay attention to the most relevant thing that is supposed to be paid attention to. So when you have a flashlight, you not only point the flashlight toward what you want to see, and then there's a beam, you have to turn it on, and that light has to be kept in that one place. And that's kind of representative of kind of attention or a task that is typical for any kind of function that a person has to do. Right? So that flashlight mechanism represents attention. With ADHD, they have trouble turning that flashlight on, like when you're pointing at the right thing, and also just keeping that flashlight pointed in that direction or pointing at the thing that they're supposed to pay attention to. So you can imagine, because there's a lot of distractions, when you have a flashlight just waving around, it's just not effective. So that's potentially one of the problems. Again, it's not saying that those with ADHD never have any attention. In fact, a lot of them can hyper focus on certain things, which is kind of the next slide. So this is another metaphor, and this one specifically talks about the Venus flytrap as a metaphor for ADHD attention or motivation. So the way Venus flytrap works is that when a fly lands inside the Venus flytrap, it will clamp shut, and it is a automatic reaction. The Venus flytrap doesn't need to think about it; it just does it. However, if there's rain or if there is a pebble or stone that lands inside, it will not clamp shut. That's just how it works. So it's like that for an ADHD brain. Not to say that there's no mechanism to help them so-called will themselves into clamping it shut, but then it's actually more challenging. And there are certain biologically correlated mechanisms going inside the person who has the ADHD to actually do the task that they are being asked to do. And this is a very important concept to bring in mind, in terms of to understand that it's not willful laziness that is causing the issue, but actually a mechanism where by the person with ADHD will have challenges doing what other people ask of them, or even they themselves want to do or need to do. Is there's something going on underneath. So with ADHD, there are also certain behavioral traits. I'm not going to go into the list here. Again, it's the same in terms of what I presented earlier with the diagnosis, except these are more specific examples of what this might look like, both in the hyperactivity, impulsivity kind of side, and also the inattention side. And you can see how it can be either very disruptive, or on one hand, especially for the hyperactivity, impulsivity, and when in social settings, like that can be a big challenge. And then the attention side can be things like related to tasks, having to do certain things, work, school, etc. And when those type of challenges emerge with the ADHD, it automatically, at least according to research, it seems to result also in low self-esteem at a very, very young age. And with that low self-esteem, it can actually develop into more challenging behaviors, such as disruptive behaviors. They may lose the motivation to learn. It's not even just that they may automatically or inherently have challenges in their learning, because that's also common for ADHD. They may have learning difficulties with certain types of profiles of how they need to learn, and they may not be able to learn in certain ways, even though they may excel in other ways. And then also just poor social skills in general. So you can see that at age 7 and then 11, like they're accumulating more and more difficulties. And then by teenage years, they actually have potentially more correlated oppositional defiant disorder, conduct disorder. So these are just challenges that they may have in a school setting or even just in a civic society, that ADHD is correlated with more challenging behavior or even criminal behavior. There's actually higher proportion of those who probably have ADHD who end up in the prison system. So this is also say that when ADHD is untreated, it's actually a problem that is more significant, especially towards childhood, or that if it's not handled in a way, then it can result in certain correlated problems. It's not saying that ADHD will cause some of these problems, but then it's something to pay attention to. And as for other types of impairments, so we're also looking at the entire lifespan of the individual. So what that means is, for example, during elementary and high school, there's a lot of different types of tasks that a child has to do and learn. Um, you may not think about those as very significant milestones, but then these are things that we expect of children as they grow up, whether it's, for example, just to start taking care of themselves by brushing their teeth, getting up at the same time in the morning for school, taking care of their social relationships and not getting into fights, having healthy friendships, even with school teachers, etc. Eventually, they'll learn to drive, so they have to follow certain types of rules. They may start volunteering, they may start working, and then they also are expected to keep their emotions in a regulated, calm fashion, or even just to respond appropriately emotionally. And then teenage years, there's also online sexual behavior. Those type of things may be challenges for those with ADHD, especially with the impulsivity. Those things can be challenging, more challenging for those with ADHD. In adulthood, the expectation is to become independent, which means taking care of your health, finances. They may become parents. They may start traveling. They may start taking care of their own households. At least that's the expectation. So these are different types of challenges, and we may assume that everybody has the same level of function, but that may not necessarily be the case. This is not saying that they're not intelligent, or some of them may not be even above intelligent, but then because of the impairments specifically related to ADHD, again, not related to their intelligence, they may have challenges with various aspects of their lives. And not only that, so with any person who has ADHD, because we're looking at, relatively speaking, a lower level of function than others in particular areas that are expected to be higher. So typically what happens for children is that their caregivers are under a lot of stress, or those around them. And when those caregivers, especially when we're talking about parents, when their children with ADHD exhibit certain types of behavior, it becomes very, very challenging for caregivers as well. There is a Pixar short, which I don't have shown here, called Float, but then it kind of demonstrates the difficulties that caregivers will have in terms of some of the challenging emotions and different types of perceptions that they may perceive from other people, which results in stressors in their caregiver, and also as a result, also the caregiver ADHD kind of relationship as well. And it's not limited to just saying that ADHD is only for children, because in ADHD, it can progress into adulthood with similar types of challenges or even ongoing challenges. So these are things that make it difficult, not just for the caregiver, but maybe from a community perspective, that these are things that need to be addressed, but perhaps are not because we don't talk about this. I also want to highlight one of the points about this as a kind of an ethnic Chinese presentation, since I also am ethnically Chinese. So on the right-hand side is basically a Confucius text. And the big idea here is that in Chinese kind of ethnic culture, there is an ideal for how to be a person who is respected, how to be a person who is being the so-called kind of onesie, which is kind of the ideal person to become. Now, there's certain types of virtues that are associated with the ideal Chinese person. So the challenge with ADHD is that those traits seem to be in direct opposition to the ideal Chinese traits, such as the prudence part. So Chinese virtue, for example, of prudence, um, they're saying is like think carefully before you act, or be cautious with your words and deeds, and think deeply and consider things thoroughly, which are inherently difficult for those with ADHD. Not saying that they can't improve, but then embedded inside Chinese culture is this idea that these traits associated with ADHD make you less valuable as a Chinese person. And associated with being seen as less valuable as a Chinese person is this concept of face, where if a person doesn't meet that ideal, then it's a problem for them. It's a shaming experience for the individual as well as for their families, and or even by extension with that, the community. So that's one very important aspect to consider when you talk about ADHD among the ethnic Chinese. Another one, especially in North America, is that ethnic Chinese, because of the racial aspects of how Chinese have been accepted in North American society, and also just globally speaking, in terms of the how it has been portrayed, is that there is an inherent pressure of how Chinese people, especially when dealing in a North American society, are expected to behave. And we call that the model minority myth, which is just to say that there is a higher expectation for certain types of characteristics to appear in ethnically Chinese persons when considered in the racial hierarchy or racial kind of comparative scheme of things. And with that comes a pressure for certain types of accomplishments and certain types of characteristics. And those characteristics, such as being hardworking, such as the prudence part of it, would be directly counteracting this perhaps even inborn ADHD characteristic that makes it more difficult for them to exhibit certain types of characteristics. So it's in the North American context, not only because you are ethnically Chinese, but because being Chinese in North America or in a Western context comes with these types of pressures. I'll talk a little bit about treatments. So Dr. Edward Hallowell is a doctor who has ADHD, and he's actually written about ADHD from a more positive perspective, from a more strengths-based perspective. And from his perspective and how he likes to communicate ADHD, it's not just a disorder, it's not just something bad. It's like harnessing and having a powerful race car engine for a brain, only that you happen to have brakes that are not so powerful. They're bicycle brakes. And this personally resonates with me as well, is it's possible to be so hyper-focused in one thing, but then it might be difficult to change tasks or to do other things that you're expected to do. This is a possible experience of those with ADHD. And this metaphor, the whole point of it is just to say that it's not, because we do have use for these things, but it's about whether it's helping the person themselves or putting them in the right environment. There are certain things that can be done to help the individual with ADHD. So what treatment does in general is to help decrease the symptoms that are challenging and to improve overall function. So when we talk about treatment, that's what I'm referring to, because there's all sorts of so-called treatments out there when you just look online or when you just go by hearsay that this is going to help, when in fact we do have certain criteria for what should help or what could help, based on what we can measure. And sometimes there's a lot of claims out there, they may not be necessarily true in terms of their effectiveness. So it has to be more effective compared to not only if treatment was not provided, but compared to others. So it's a comparative process. And we're talking about the evidence of how things work or don't work. There's a lot of awareness. There's a lot more awareness now of ADHD, but there's also a lot more questionable practices when it comes to so-called treating ADHD. So the metaphor here is when you have a car that you're not going to change the whole car, but you can change certain components and you can change a car in terms of the way it's driven, which means that you can learn certain skills, and then you can also try to improve certain areas. But it's like in any engineering process, it has to be very precise. You don't want to do the wrong thing. And with treatments, at least in the psychotherapy field, what I've studied is that there are individuals who've really done a lot of work to try to scientifically improve some of these treatments or try to come up with ideas that are potentially helpful. They're not just coming up with these because of some sort of idea out there that they can't back up with evidence and proof. So at least that's the ideal. I'm not saying that all the treatments themselves have a lot of effectiveness or even the same effectiveness, but I'm saying that there is a certain threshold for how treatments ought to be done. And unfortunately, a lot of the times when people sell ideas about what treats ADHD, they're not speaking based on the evidence. They're not speaking based on informed opinion. As for treatments for ADHD, typically we're talking about something that's multidisciplinary and multimodal, meaning that you can't just get rid of ADHD completely just because you pop a pill. The pill will help you increase your capacity to perhaps have more executive functioning capacity, but you're still going to have to so-called learn the skill. For example, for problem solving, if you're presented with a problem, if you have a math problem, the ADHD medication is going to give you more ability to focus on the task. You're still going to have to do it, the task itself. You're still going to have to learn the skill of walking through a problem, breaking it down to smaller steps. These are all things that have to be done on top of increasing that capacity that will ultimately result in that person's success. So we talk about things like medication, but we also want to consider psychotherapy, coaching, skills training. Occupational therapy specifically is another type of professional help that they can get, which is very helpful to have practical tips and also practical changes to how an individual can perform and have success in their work, their school. They can also get accommodations at school by talking to school principals, to teachers. In Ontario, you can get something called an individualized education plan, especially in the public school system. Perhaps sometimes that looks like getting more time on tests, or when certain individuals with ADHD, they can't read the question because they find it very difficult to read words, they can have someone verbally repeat that to them because then that is actually what helps them process and learn. And of course, the basics like healthy exercise, healthy eating. Specifically for ADHD, you also want to try to not only focus on the things that you're trying to help them get better at, which sometimes can come across as just you're trying to fix me, right? So you also want to try to focus on things that they're really good at and that things that they're inherently naturally inclined to be good at. So that's what it means to have a strengths-based approach, is to tap into what they're good at, what they're interested in, and then keep them building on that, because that can be really effective as a source for helping them get better. And you want to look also at parenting and behavioral interventions. Some parents get into a very challenging pattern with their children with ADHD, whether it's the nagging, which potentially could be very ineffective, not only for communicating what needs to be done, but also could be very bad in terms of the negative consequences on the child's self-esteem. And different types of interventions in that area, basically for behavioral challenges, you can try to just adopt what you want to do with reinforcement strategies as well. So behavioral kind of approaches to parenting. There's more positive approaches as opposed to just doing whatever your parents did to you. So also you want to look at things like caregiver supports, because you recognize that in this presentation and even just hearing that there are more challenges potentially that come with the ADHD diagnosis, especially in children, but potentially also with adults. So those who are giving care for those with ADHD, those people need care. And those people need additional support. So there's support groups not only for those with ADHD, but also there's support for caregivers as well that is worth a look at. For psychotherapy specifically, yes, we do look at various aspects, and all of these aspects are probably helpful for individuals even without ADHD, but these are just highlighting some of the core areas that I believe are important for individuals who have ADHD. So you do want to work on helping them with their self-esteem, because it's very, very deflating and demotivating for your confidence to not be able to do what is expected of you. So we want to really help them build up their self-esteem. We want to help them regulate their emotions, because when they can kind of channel their emotions in a positive way, they can actually do what they want to do or what they would like to accomplish. But if their motivation is down, sometimes it's because their emotions are down. So if they can regulate their emotions better, more effectively, have different strategies. Sometimes we're dealing with trauma. We're dealing with just conflicts that have happened, maybe bullying, just not only being on the receiving end, but even bullying others as well, which could happen. So these are traumatic experiences related to that. There's grief. Cognitive errors can be common as well, in terms of sometimes very black and white thinking, simplistic thinking, jumping to conclusions. You want to help them problem solve, break down problems into smaller pieces. You want to teach them how to have healthy relationships instead of just going with what their impulses tell them. To have empathy is actually a learnable skill, but it could be particularly challenging when you have executive function deficits, in terms of slowing down enough to actually understand another person's perspective, giving what other people want instead of just what you want. So these are not necessarily inherently intuitive to somebody who has the ADHD diagnosis, but they would need if they want to be successful in their social relationships. And that also carries over to family and intimate partner relationships. That would mean not only individual therapy, but potentially couples therapy, as well as family therapy. And the term therapy sometimes in this case is just thrown around, and then people don't kind of understand, oh, like it just seems to be taking it to a professional. But it goes beyond just taking it to a professional, but just really having ways to effectively learn how to interact in more effective ways. And it's not specific to ADHD. There's a general lack of acceptance of just being able to talk to somebody to try to make better sense of the situation, which is what psychotherapy can do sometimes. It's more than advice giving, but it's kind of working together, especially given that there is the therapist who is potentially someone who has a bit of an educational background to help give a bit of guidance of how to make things better. It's not a guarantee, but it's a potential change or step um, built on the experience and built on research, built on the different types of wisdom that is accumulated by others. So that's the general sense of why psychotherapy could be especially important for ADHD. And this is the last slide, pretty much, the last information slide. And I want to talk about this book, just the title of it. It's a recent book by a Taiwanese educator who would work with those with ADHD. It includes numerous contributors who also have ADHD. Some of them are just professionals or accomplished individuals on the spectrum. But in terms of the title of the book is called Attention, Diversity, Hyperactivity, Dreamer. Okay, and what this means is it's that even though those who have ADHD, their diversity, I mean their attention may be showing in ways that are diverse. They're different. There's diversity in the way that they have attention, and it's actually reframing it not just as a disorder, but something to accept in terms of just the overall scheme of things. There are different ways that people can be. There are different ways that people can have attention. And specifically with ADHD, they can hyperfocus on certain things, and when they hyperfocus, they can really get things done. So that's one area of difference. It's not necessarily a bad thing. The hyperactivity, again, it maybe enables them. Some of them are athletes. They can really hone that energy and hone that special attention and motivation that they have into something and really do it well. And the dreamer part is the creativity that can also come with ADHD as well. So we want neurodiversity. We want people who can think differently in the world so that we can have a more diverse and even just allow for different types of people to contribute to society. So that's why I believe this book's title was really helpful in terms of to reframe the whole thing, not just as a so-called disorder, but as a diverse a diverse trait that people can have, and that's the way that they can contribute. That's the way they can be. So these are just some ADHD resources from various professionals, from diverse organizations. I especially wanted to put the book ADHD 2.0 here by Edward Hallowell because he, again, takes a more of a strength-based approach for ADHD. And he also has a Chinese translated book for that same title. He's actually written various books on ADHD, but this is one of his newer ones in which he is quite positive in the way he reframes things, as well as uh, just giving practical advice of what to do with it. He does take more of a medical perspective. Um, so that's kind of how he approaches the book. There are a lot of resources out there for ADHD. I want to warn again that um, not everybody who talks about ADHD knows what they're talking about. Um, they may not necessarily give the most effective advice, or even sometimes they may not be um, out of just necessarily trying to help, but they may be motivated to try to sell a product, which is understood. But in terms of not all interventions are equal, so that's just something to pay attention to. That maybe at least from my personal experience, and also from my profession, is that um, medical the medical community has had a lot of positive contributions to ADHD. I'm not saying that it has to be absolutely correct, but I'm saying do consider their opinion as something when you have ADHD in the mix, because a lot of their resources have been proven to be effective for a variety of populations that could also be effective for those who you know. So that's the end of this presentation about ADHD. It's, again, very much just a primer. There's a lot more I could be talking about, but this is just a quick intro in terms of just giving the glimpse of what ADHD is like, and perhaps that I hope those of you who are listening can consider how you can help others or even yourselves in this journey. So that's it.